We've been asking you to send in your questions all week about getting a little help in the cosmetic department. From baby Botox to Profilo, we've had your queries come in droves, all ready to be answered by one of London's most forward-thinking cosmetic doctors with over 25 years in the industry and a seriously impressive client list, of which I'm one, Dr. Richard Sibthorpe. Welcome to the show. And I say that because, you know, I'm pretty fussy about these things, and I very much believe that less is more. So, and I was recommended to you by a friend, I always talk about this story, who walked into my house and I said, you look really good. You've had something done, haven't you? And anyway, the rest is history, and here we are.
Indeed.
So, thank you for joining us.
Thank you.
I've got lots of questions to get through, so I'm going to fire away and ask you, first of all, what the main difference is between Botox and fillers, because I still think a lot of people don't know, right?
I think there is confusion. Simply, Botox works on muscles, and fillers are hyaluronic acid, which is a form of collagen, and used to replace lost volume and provide lift where you need to.
So Botox freezes your face.
Freezes your
muscles.
face, hopefully not too much.
See, I can still move my forehead.
You should have movement.
And fillers fills in the gaps.
Fills
what
in
it
the
says
gaps.
on the tin.
Yeah.
Okay, and how long do each of them last?
Botox typically lasts 3 to 4 months, and fillers will last a year or 18 months.
Okay. Fillers are more expensive, right?
And they're more expensive.
Okay, but they last longer. And do you find that these days it's a combination of both? I mean, I know you said before that you think Botox is being replaced by fillers.
I think ultimately Botox will become replaced by fillers because fillers addresses more of the aging issues and the causes. But yes, they're used in combination a lot of the time.
And is that the most effective way to tackle the aging process?
It is at the moment,
okay.
Until something else comes along.
And I think, you know, so many people worry that it's unregulated, you know, is it safe? Are there going to be horrible side effects that you find out down the line? What would you say to people who are nervous about the safety aspect?
Do your research. Find someone that has a reputation or is a recommendation or has an accreditation with a society or organisation. Find out how long they've been doing it. Have a look at their before and after photographs, particularly with filler work, I think.
And do they need qualifications? I mean, there are lots. I know someone sort of locally who's doing a load of people. I don't think the results are great. I don't know who she is, but she's not you. You know, is it safe to go to people like that? Are you looking for a particular...
I personally think that these sorts of procedures should be administered by qualified medical practitioners.
Okay.
I don't think they should really be administered by beauty therapists.
Okay. And qualification is the word I was looking for just then.
Yeah.
What is the qualification?
Medical qualification these days would be a doctor or a dentist or a nurse will have some of that medical qualification as well. So.
Okay. Let's talk about the cost. When it comes to Botox, you often hear a cost, 300 quid or whatever it is. How does that cost work? How is that cost worked out? Surely some people need more than others.
Yes, typically in this country and most of Europe, we charge by the area.
Okay.
And in America, they charge by the amount of units of Botox that they use. So typically it will range anything from, well, we now have Superdrug coming to the market. So
what do you think about that?
I don't think that's necessarily a good thing. I think it's making it very, I don't know, it's making it too accessible almost, demeaning it.
Okay.
I think it has to be done properly. And I think it's a walk-in, walk-out procedure. It's like going to get your makeup done in the...
Yeah, I know you're very thorough about these things and you plan it and you write down where you've had it so you go back next time and you have the same amount. I can't imagine you get that.
I mean, we have a lot of rules and regulations in the medical profession. We have a lot of protocols to adhere to and consent procedures. So I just wonder whether they'll go through that same sort of rigmarole. And
I imagine it'll be quite well regulated. It's just the real consideration of every face and going, right, this is your face and you need a bit, you know, the time you...
And I think that's the other thing is that it is very much, I think, a bespoke procedure. I've always had this approach as a less is more approach, and that you can build that blueprint
Yeah,
of
exactly.
someone's face that's rather unique to them, and not just go by the book and
Yeah.
join the dots.
And freeze the face.
Freeze the
One of
face.
the questions we had from someone is there are so many celebrities that have it done and they look like they have, as she's put. How do you recommend she gets it done without making it obvious? I mean, you just said less is more. I think that's why you're so good.
More, yeah.
Yeah,
I mean, you
it's
can
as simple
always
as that.
put more in,
Yeah.
and you should have complimentary reviews at 2 or 3 weeks following a Botox procedure, and that's the point at which you can then put some more in.
Yeah.
I think making careful notes as well, and as I said, less is more. Maintain animation.
Yes.
It's very important. You don't want to look frozen. You don't want to
No,
look
that's the worst, isn't it?
rabbit in the headlights.
Yeah, exactly.
Yeah.
Okay, as someone's asked, is there an approved or recommended list of practitioners?
I wouldn't say there is. I would say there are organisations that are involved in training of those practitioners. So, for example, not every doctor necessarily is going to be good at Botox. They have to go on training courses.
Okay.
There is the British College of Aesthetic Medicine. There's the British Association of Cosmetic Nurses. So there are these organisations that are solely focused in the aesthetic arena.
Okay. We've recently written a piece on our favourite, our top practitioners, of which you're one of them, in the UK. So check that out if you're watching. Somebody said, I'm 25 and having Botox around my eyes. Is this the right age, and what should I be careful of? I do have very bad lines around my eyes. I'm not over-exaggerating, is what she said. 28,
28.
Botox around the eyes. What do you think?
I mean, we do it, yes. I would always say, as a younger person, you should be focusing, it should be skin, skin, skin. You should be looking after yourself with hydration, no smoking, less alcohol, good skincare regime. Derma rolling is very a natural way of maintaining good skin quality.
You just don't want it, when you smile, it to sort of pucker under the eyes, do you, if you have too much?
Yeah, I mean, I think the other thing is if you have too much Botox around the eyes, you typically become more cat-like, and you can see wrinkles chased in towards the nose. So
yes,
I
that's
think,
not a good
again,
look.
we're back to the less is more aspect. So.
Okay. Someone said, what happens if you start using Botox, i.e. frown lines between the eyebrows? Do you have to continue forever? No.
No, you don't.
Because it just wears off, doesn't it?
It wears off, and you're back to where you started. You've not gone back in time. You've just prevented. You sort of put time on hold a little bit in terms of those wrinkles.
Someone said, I'm diabetic and on insulin. Can I have Botox in my forehead?
Yes, you can, but as a diabetic, you're more prone to infections. So that's one of the rules following Botox is really not to touch the areas or even use your makeup, which comes from a Petri dish sometimes, into the areas that you've just been treated. I usually allow 3 or 4 hours for the holes to close, but you don't want
any makeup?
Before anything gets applied, whether you put your dirty hands or your makeup.
Okay. How much downtime is required after Botox?
Very little. It's a walk-in, walk-out procedure. There are rules, myths that are going around in terms of what you can and cannot do, but a lot of those have been dispelled over the years. So
Very little.
Yeah,
Fillers, downtime?
Fillers, I think more so, you are more prone to bruising and redness and swelling, and so particularly in the lips, for example, if you have any lip work done, you
yes,
really
I think we
should.
just saw your video that you did on Maya's lips, which look incredible, I have to say.
Well, yes, thank you.
I know you were very
but you really
cautious
do have to
of
go
that.
home, and you have to ice, and you have to apply that ice for a long time, because every time you put a needle, particularly into the lip, it will swell whether you put anything in there or not. So I think that's one of the areas particularly that's prone to bruising as well.
Yes, so a bit of downtime with the lips.
Yes.
It says here, is there a way fillers can change the shape of your nose and make it look thinner and smaller? Well, we know there's lots of talk at the moment about these non-surgical nose jobs achieved by fillers. How does this work?
There's a new thing coming in now, which within the industry, which is now more about beautification. And this really falls into the realms of beautification. So if you have a crooked nose or a hooked nose, or you're not happy with the nose, you can have what is called a medical rhinoplasty, which is essentially using fillers at various points in the nose to straighten things out.
And are you seeing this request more and more?
Yes, I do. Yeah. It's another popular treatment, I think, alongside the lips. that's coming, online, so to speak.
And it works well. I mean, I guess if you have a bump, I mean, size-wise, it's not going to do a lot, but it's if you have a bump or a hook or.
I think a lot of people it's usually a correction of the profile.
Okay.
So they may well have a hook here or a bump here or a deviation here. So a lot of that is easily corrected. But again, needs to be in the hands of a skilled practitioner, because we're going back to anatomy here, and we're thinking about arteries and not wanting to put filler in those or around them too much.
Someone has said, what do you suggest to women who really want to try fillers but their friends and family are being judgmental? Don't tell them, surely.
I would, yes.
Surely they're never going to notice.
Again, if it's done
subtly,
you shouldn't really notice anyway. It's a gradual improvement, and it's a refreshment aspect, particularly with fillers too.
Okay, my husband said I don't want to know. He's like,
a lot of the
don't want to know.
A lot of the wives don't actually tell their husbands, I think.
What would you say is your signature treatment?
Signature in terms of what I think is my favourite, or signature what is most popular?
Both.
Both. Well, Botox is still the most popular treatment.
Okay.
And Botox here is the most popular area to treat. My favourite treatment is is really to do with a much more global approach in terms of, and I have to say it's usually in an older person, usually 35, 45 plus. It's really to do with lifting, or what they call modified 8-point lifts. So we're addressing all areas of the face, around the eyes, cheek, front of the ear, jowls, jaw, chin, lips, everything here.
The full shebang, the full works.
The full Monty.
You just mentioned age there. Obviously, every face is different.
Yes.
But people do say a lot of the time, what age should I start? What age should I start? Whilst everyone's different, roughly, what would you say? When do you start to see most of your patients? And I always remember, I think it was Trini saying that it was a sort of preventative thing. Is there an argument for sort of preventing the aging process by starting younger?
Yes, there is an argument for that, and there's research behind that. Certainly, if you start to have small amounts of fillers, you will actually stimulate collagen production yourself. You will actually increase your supporting tissue, the density of it, so you will age better. And similarly with Botox, you will prevent a lot of the wrinkles, particularly around this, what we call the glabella region.
Because they don't mark your face as much, do they?
No.
Okay.
So there is a term called a facial pause button, particularly with this filler work. Okay. Yes, it is good to start early. I think it's important also to remember that when you're in your early 20s, again, I go back to what I said earlier, skin. Look after the skin, because that's like our tablecloth on our table. And if that is nice and clean and stretched, it has elasticity, then you're going to look good anyway.
Okay. But what age would you say roughly to start to think about it?
I think that again goes back to your lifestyle, to be honest with you. Okay. I think you could look fantastic at 25. You could also look terrible at 25. Okay. You could have gone through a lot of stress. You could have gone through a lot of, I don't know, lifestyle, partying, who knows. And so I think as a rule of thumb, certainly we're not allowed to give cosmetic treatments to anyone under 18.
Okay.
But as a rule, I think my youngest patient is something like 28.
Oh, really? That old?
But then I'm treating younger patients for things...
Don't mean old, I just mean,
I'm treating younger patients for more skin problems like acne.
Okay.
So I think there are different issues as well at different stages.
So would you say under 28, you're really probably too young to be worrying about it?
No, I wouldn't say that. I think it's a grey line. I would say that there's, my daughter's 25 and I wouldn't recommend it to her, but she might come to me in 3 years and ask the same question, so what am I going to say then?
Don't know, she's your daughter.
That's right.
Let's talk about the lines from your nose to your mouth.
The nasolabial folds, all
because
lines.
That can look really bad if those are overfilled. To me, that's like the worst. It's almost worse than a frozen head. Is someone that's just like, it's like a pillow, isn't it?
That's the old-fashioned way. Was when we started 15 or many years ago. We started by putting fillers just down here like a sausage. But in fact, these folds here are the early signs of aging in terms of mid-face deflation and descent. So we have fat pads and they deflate and they gravitate south. So these are the results of that. So really treating this area is actually treated by indirectly treating higher up to give that lift.
Lifting it up.
Yeah.
Yeah, that makes sense, doesn't it?
Yeah, so you're kind of lifting things.
Okay. Someone's asked what type of fillers are best for under the eyes. I've seen some places they'll do your lips and then use the rest in your tear ducts. Somewhere else I read that it should be different types of fillers for different areas.
There are different fillers, certainly, for different parts of the face. I mean, tear troughs here and lips, generally, we do use fine fillers.
Okay.
But there's also a difference between them as well sometimes. Again, it depends on assessment of the lips.
Okay.
And very important here is getting the correct depth, the correct technique, and again, huge amounts of anatomy there with problems if you go wrong.
Okay. Question here. I'm considering getting a very small amount of filler in my temples where there's loss of volume before my wedding, but I'm worried it'll change how I look and be noticeable. I want to look like myself, don't want anyone to notice, just to look refreshed. Should I do it, and when is the ideal time before a wedding to have this done?
That's an area actually I notice a lot in the ladies. They lose volume here more than the men. And it's an area also that you have to do in stages, because there is only a certain amount of filler that you can put into that area, which is usually a maximum of 0.5 ml each side. And some people may need 1 or 2 mils syringes. So in terms of staging before a wedding or any event, red carpet event, etc., I always say, plan these things well in advance. 3 months.
Okay.
I would say 6 weeks is a minimum. Anticipate bruising. You don't want to give someone a bruise as they end up in their wedding dress.
No. Someone else, another wedding question. See, clearly everyone's doing all they can before they walk down the aisle. I'm 30, getting married next year. Generally, my skin's okay. I have a couple of frown lines. My concern is, can you have it once and then leave it, or will your skin then look saggy and odd if you don't continue with the injections?
So, can I say it reminds me of a joke, because I did have a woman that came in and said, make me look good, I'm in the market for a new man. So it makes me think that we get married and then that's it done. Maintenance, I don't know. You can, sorry, the question was you can have it done once?
Will it go saggy if you have it done once and don't have it done again?
It won't go back to where you were before. There'll be an improvement, because, as I said before, you get a degree of collagen stimulation. You're replacing some of that lost volume.
Okay.
But yes, we age every year. So
my reckoning is you'll like how it looks, and you won't want to just have it once. You'll be back. Nearly out of time. Very quickly, if your upper lip is smaller than the one below, can you make it bigger with filler so they look alike in a natural way?
Yes,
look
you
at
can.
Maya.
Yes, you can. But there's an interesting thing between the different ethnicities. If you look at this ratio, top to bottom lip, if you look at Afro-Caribbeans, it's usually 1:1. In the Caucasians, it's usually 1 to 2/3. But now there's a vogue, and I go back to this beautification aspect, there's a vogue to have the 1:1 amongst the Western society as well. So the slightly bigger lips and the 1:1 ratio.
It's got to be so careful with lips, haven't you?
So careful.
Finally, just tell us about Profilo. We've written about Profilo, but for people watching, it's an amazing treatment.
Profilo is an interesting product. Most of the fillers that we use are what they call cross-linked, which makes them more stable and it gives more longevity. This is a combination of hyaluronic acid that's not cross-linked, so it's more of a skin booster, skin hydrator type of filler. But what we're finding with that is we can use it on areas around the body that we probably wouldn't use the other fillers, so particularly neck, décolletage, the backs of the arms, wherever the skin, and if it's a much softer treatment, it's more appropriate actually for the younger person. So it's a much better hydrator, I think, in the younger person. It's meant to just make you look
really, really well, isn't it?
That's right. Yeah, it doesn't last as long. That's the only thing, and that's that non-cross-linking aspect.
Okay. But you have it in your face as well as these other areas.
And you have it in the face too.
Okay.
Yeah.
Parting words of advice for anyone thinking of going into injectables?
Do your research.
Do your research.
There you go. Research.
Thank you so much, Dr. Sibthorpe. Great advice for, I'm sure, our readers who are thinking about going down that cosmetic treatment route. It's not all bad. For more information on Dr. Sibthorpe and his services, please visit drsib.com. As always, all the information will be linked below. After the break, I'll be back with the SheerLuxe ladies talking about all the things we're loving this week.